Good afternoon, students. Today we are going to study about the diabetes mellitus. So let us all learn about the basics of diabetes mellitus and then proceed to the biochemical complications of diabetes mellitus and the diagnosis of the disease. So what is diabetes mellitus? It is commonly called as diabetes. Just like the other diseases which are threatening the world like cancer, cardiovascular disease, diabetes mellitus is a very dangerous disease. It is a non-communicable disease. It is one of the very important non-communicable disease, and it is a chronic disease. So you can call diabetes mellitus as a metabolic disorder characterized by the presence of hyperglycemia. That is hyperglycemia, chronic hyperglycemia. That means the increased concentration of glucose in the blood for a very long period of time, accompanied by greater or lesser implication in the metabolism of carbohydrates, lipids, and proteins. So you have to first understand about the metabolism of carbohydrates, lipids, and proteins. So we all know that the food we eat contains the macromolecular compounds like carbohydrates, proteins, lipids, and some minor compounds like the vitamins, minerals, along with the water. So this carbohydrate and the lipids serve as energy producers. So they give energy to the body. So when these carbohydrates and lipids are metabolized, they give rise to ATP molecules, which are very important for the energy for various reactions. The proteins, it is a bodybuilding food. Okay, so it is very important. What happens is when these carbohydrates, lipids, and proteins are consumed by the body, it consumed by the mouth, it will enter the gastrointestinal tract, and it will be converted into smaller substances called as glucose. That is the smallest unit of the carbohydrate. Fatty acid and glycerol, the final unit of the lipids, and amino acids, which is the fundamental unit of the proteins. So they are digested by the different stages of the GI tract. Okay, it enters the mouth, it enters the stomach, then undergoes digestion in the stomach, in the duodenum. Okay, they will be acted upon by many enzymes which are produced in the by the saliva, by the gastric glands and the intestinal glands. And I hope you all have studied about the digestion very clearly. I think you have to recall the digestive process, digestive physiology. Okay, so they will be converted into individual components like the glucose, fatty acids, glycerol, and amino acids, and it will be absorbed by the bloodstream or the lymph, and it will be taken to the liver, and from the liver it will be carried to the different parts of the body. So this glucose serves as the immediate fuel for the body. So when the there is a glucose is carried by the bloodstream to different parts of the body, it is taken up by the cells of the body. Okay, through several mechanisms, they are transferred to the inside the cells, where the cells utilize the glucose. They oxidize the glucose by the there is the oxygen is received from the air we breathe in. The glucose undergoes oxidation, and it will give rise to many number of ATP molecules. Similarly, lipids are also oxidized, and they give rise to ATP molecules. So the number of ATP molecules produced by the lipids are much more than that of the carbohydrates. Carbohydrates serve a very important fuel, immediate fuel for the body and the brain. When the brain does not receive the glucose, you will faint. That is due to starvation. When you don't eat food for a long period of time, the brain does not receive glucose. The glucose is the immediate fuel for the brain. But other parts of the body also can get the glucose from the other components, but the brain receives the glucose from the brain. If that does not happen immediately, you will feel the dizziness or the fainting. Okay, so this is what we have to understand. So this is the basic. So suppose where we take in food, and usually we take food 3 times a day. So when there is a long gap between the intake of food during starvation. What happens is the body immediately makes up for the glucose availability. That is, the excess glucose what you have consumed would have stored in the liver in the form of liver glycogen or muscle glycogen. If but We South Indians as well as North Indians eat the chapati. We South Indians eat a lot of rice. So when we consume a large amount of carbohydrates, the carbohydrates will be utilized by the body for the fuel. But if it is excess, it will be converted into glycogen, both liver and muscle glycogen. And even if there is some more excess, it will be converted into fats and stored in the adipose tissues. So what will happen when there is starvation? The fats, that is the acetyl, it will be triglycerides will be converted into acetyl CoA, and the acetyl CoA will be further converted into glucose or one of the mediators of the TCA cycle, and it can produce energy in the form of ATP. Similarly, the proteins also, the different amino acids of the proteins, glutamic acid, different amino acids can serve as mediators for the TCA cycle and produce energy. So in this way, even if the body does not consume food for a long period of time during starvation, the body will be able to function and get its energy from the lipid or the protein buildup of the adipose tissue and the body muscles. So that is how some people you would have heard undergo starvation for a period of 40 days, 41 days. So they can survive. But then by then the body will become adjusted to the this new kind of thing. So you would have understood that a person consuming large amount of food becomes obese. That is because of the storage of conversion of glucose into lipids and storage of these triglycerides in the adipose tissues in the abdomen. So this obesity is a very threatening condition which leads to diabetes. So what happens is when a person consumes large amount of food, he has the habit of taking excessive amount. His stomach will adjust. Stomach is an elastic bag, so the stomach will be will can contain more amount of food. Whereas a person who is having the habit of taking lesser quantity of food, the stomach is very small. He feels satiated, the fullness by eating a small quantity of food. Whereas those people who are eating a large quantity, they will not be experiencing the fullness if they consume little quantity. They will want to have more and more amount of food. So this is the condition. That is the habits, the food habits, and the consumption of more amount of carbohydrates, junk food, and all these. That is the latest food habits, no, of school going children and the college children, or the people having the habit of eating a large amount of carbohydrates, junk food, maida, all these are complications which will lead to diabetes mellitus. So obesity is a very very important factor for both the diabetes as well as the cardiovascular disease. So this is where we have to take very important care in avoiding consumption of excessive amount of carbohydrates. Okay, now let us come back to diabetes mellitus. It is a chronic metabolic disorder characterized by the presence of chronic hypoglycemia, that is, high levels of glucose in the blood. And also, there is a lesser impairment in the metabolism of carbohydrate. So, what happens when the glucose is not utilized by the body, it is not transported to the cells will become fatigued. So the glucose will be present in excess in the bloodstream. So this will go and get accumulated in different parts of the bodies, especially the extremities, the peripheral. That is why the people have neuritis, and the kidney damage, brain damage, eye disorder, all this will happen. So the excess of glucose present in the blood is very dangerous. Since it is not transported to the individual cells, it will get circulated and get deposited in different parts of the body, leading to various conditions. There are three major types of diabetes. One is the type 1 diabetes, type 2 diabetes, and gestational diabetes. So type 1 diabetes, it is called as the immune mediated or idiopathic. It is insulin dependent diabetes. Type 2 diabetes is it's called as the non-insulin dependent diabetes, and gestational diabetes happens when a woman is pregnant. So all types of diabetes mellitus have something in common. Normally, your body breaks down the sugars and carbohydrates you eat into special sugar called glucose. As I told you, all this I have told you: the metabolism of carbohydrates, the digestion, everything I told you. Glucose fuels the cells in a body, in your body. So, what is the main factor that will help in the transport of glucose into the cells? So, there is a hormone called as insulin, which is secreted by the beta cells of the islets of Langerhans of pancreas. So, this insulin is a hormone which is present in the bloodstream, and it is secreted whenever the digestion is over. Okay, it will help in the transport of glucose from the bloodstream to the individual cells. So there are many transporters called as glucose transporters, GLUT1, GLUT2, many different varieties are there. So they will help in the transport of glucose from the bloodstream to the individual cells of the body. So insulin plays a very important role. When there is absence of insulin, or when the body experiences some resistance to insulin, it will lead to diabetes mellitus. That is, in that case, the glucose is not transported into the cells, and they get accumulated or concentrated in the bloodstream, and it will be excreted out of the body through the kidney as in the urine. So normally, glucose and the proteins are larger molecules which should not be excreted by the kidneys. It should not be present in the urine, but when it is excreted, that is a condition where you can identify or diagnose the diabetes mellitus. So this hormone insulin plays a very important role in transporting the glucose from the bloodstream to the cells. So there are different types. That is, when we discuss about the type 1 type 2 diabetes, you will understand the role of insulin. So with diabetes mellitus, either your body doesn't make insulin, or it cannot use the insulin to produce, or a combination of both. So type 1 diabetes, either the pancreas gets affected. So the pancreas may get affected because of some autoimmune disease, or some damage, or surgery or something. When the pancreas gets affected, usually it is because of the autoimmune disease. The percentage of type 1 diabetes mellitus is very less compared to the type 2 diabetes mellitus. So because of this, the insulin production gets affected. Okay, so the amount of insulin produced is very less. So this cannot help in the transport of glucose, the more number of glucose into the cells. So insulin will not be present to play the role. In type 2 diabetes, insulin will be produced by the pancreas, but what will happen, there is some resistance. That is, insulin will go and reach the cell, and there should be some receptors which will to which the insulin will bind, and it will help in the transport of glucose into the cell. But here, there is some resistance to the insulin that has been produced, or a combination. That is, either the insulin is absent or less, or it is resistant. Because of this, it will result in type 2 diabetes. So the cells can't take in the glucose, as I told you. So it builds up in in the blood. The concentration of glucose in the blood increases. So high levels of blood glucose will damage the tiny blood vessels. Okay, so high levels of glucose is not good. It will damage the tiny blood vessels in your kidneys, heart, eyes, or the nervous system. So that is why, if the diabetes is left untreated, it will lead to other diseases, complications. Like, the person who's suffering from diabetes will experience a silent heart attack. So it will stroke, it will cause kidney disease, or blindness, and even nerve damage to the nerves in the extremities. Okay, so sometimes when there is a cut or a wound in the legs or the hand, it will take time for the healing process. So eventually, if it is not treated, the doctors will have to amputate that particular toes or fingers, or sometimes the foot, or a larger area of the leg gets amputated during diabetes mellitus. So people suffering from diabetes mellitus should take care to reduce the amount of intake of glucose, and as well as control the level of glucose in the blood. because as the level goes up, it can damage the blood vessels, heart, eyes, and the nervous system, kidneys, etc. We have to take care that the blood glucose is under check, under control. If that is not happening, it will lead to a lot of complications. So the food habit has to be controlled, and the necessary medication has to be taken to control the diabetes mellitus. If it is not checked, it will lead to a lot of complications. Now let us see the history of diabetes. So the first known reference comes from the Egyptian papyrus, dating back to 1550 BC. So the diabetes was named by the Greek physician called as Aretas between 30 and 90 AD. So it is a very, a disease which has been identified long time ago. Avicenna, a famous Arab physician, described the complications of the disease and how it progressed. So he is a person who gave the description about the disease and how it progresses. French physician Bochadat recognized the importance of calorie intake in the 1870s. See, 1870s itself, he has stressed the importance of calorie intake. We are taking Pepsi, Coca-Cola, and so many other things, which is having zero calories. Okay, taking a large amount of sugar, that is the mm, white sugar. White sugar is very very dangerous. So white sugar, the juice, fruit juices, Pepsi, Coca-Cola, bottled drinks, and the fruit juices. The fruit has to be consumed as a whole, and when it is converted into juice, it gives more amount of sugar is added, and the person consuming it will have more amount of glucose in the blood. Paul Langerhans, he is the person who identified the importance of pancreas. So, where is this insulin secreted, and which cells are secreting the insulin? The islets of Langerhans of the pancreas secretes the hormone called as insulin. So, he is the person, Paul Langerhans. He identified the importance of pancreas in the 19th century and discovered that islets of Langerhans is a group of cells that would produce insulin. Frederick Banting discovered the hormone insulin and won the Nobel Prize for his efforts in the 1920s. So all the discoveries are made in the 19th century. So let us discuss about the type 1 and the type 2 diabetes mellitus. As I told you, type 1 diabetes occurs only in 5 to 10% of the population. Type 1 diabetes mellitus, that is the juvenile diabetes, mainly type 1 diseases can be diagnosed in very young that is children and young adults. So it is character. What happens is, as I told you, some autoimmune disease will lead to destruction of the beta cells, and because of the destruction, the insulin producing capacity will be lost, and the pancreas will either produce very little amount of insulin or no insulin at all. So this immune system destroys the beta cells in the pancreas, and only the only cells in the body capable of making insulin. So if that is lost, insulin is not produced. So the body cannot process the glucose that has been derived from the food substances. So it cannot be taken to the individual cells for metabolism and fuel. So previously known as juvenile diabetes because it most often diagnosed the children and young adults. So type 1 diabetes is usually characterized by the presence of anti-glutamic acid decarboxylase, islet cell, or insulin antibodies. So there are antibodies, autoimmune disease, no? Insulin antibodies are identified, okay, which is the cause for the autoimmune process that will destroy the beta cell. So all type 1 diabetic patient will require insulin therapy to maintain normoglycemia. So if the people suffering from type 1 diabetes mellitus, if insulin is given to this person, he can maintain his glucose level. But type 2 diabetes mellitus, as I told you, it is because of insulin resistance. Even if insulin is given, the person cannot maintain the blood glucose level. And for him, the proper medication apart from insulin and diet and exercise should be administered. Okay, so this unlike type 2, diet and exercise cannot prevent it. The type 1 diabetes cannot be prevented by walking, exercise, and diet. It can be prevented only by administering insulin. So there are insulin replacement therapy. So insulin can be supplemented by injection. You could have seen people, elderly people, taking injection in the thigh. It is a small 1 ml needle, okay, syringe, and they themselves inject insulin. And sometimes there are insulin pumps, their measurable amount of insulin will be kept there, and they can simply inject the insulin into the muscles. So here strict dietary management is required. So the carbohydrate should be tracked at very regular intervals of time, and monitor the glucose levels. So initially, the people in olden days used a spirit lamp and a Benedict's reagent. So they will check the urine, the blood level and the urine. If the color, there will be color indication, no, yellow, orange, dark brown. These color indication will show the increased concentration of glucose in the urine. So this is a measure by which they will monitor the glucose levels in the urine. Later on, they checked the blood glucose both in the fasting and the postprandial condition, or to check the concentration of glucose in the blood also. And nowadays there is a lot of prick test available. So one drop of blood is enough to diagnose the concentration of glucose in the blood. Wow. So as I told you, these are pictures showing the insulin injection and the insulin pumps. What about type 2 diabetes mellitus? So 90 to 95% of the human population have been diagnosed by type 2 diabetes mellitus. So pancreas produces insulin in this case, but the body's response to the insulin is very low. So unlike type 1, it is usually late onset disease, meaning it develops later in life. So usually the type 1 diabetes are seen in children and young adults, but type 2, because of the lifestyle, food habits, lifestyle, sedentary lifestyle habits, all these things, obesity is the main reason, it will lead to type 2 disease. So it comprises 80 to 90% of all the cases of diabetes mellitus. So maybe we are at fault. So, most individuals with type 2 diabetes exhibit intra-abdominal obesity. So, as I told you, obesity is a very important cause which is closely related to the presence of insulin resistance. So, this is an acquired disease, okay, acquired chronic metabolic disease. It is, as we can see, it is seen in the later stages of life. So, we have to take care about the food habits and the lifestyle. In addition to hyperglycemia, the person can experience hypertension, blood pressure increases, dyslipidemia, high amount of triglyceride, and a low HDL cholesterol level, and also hyperlipidemia. Lipids are concentrations are more. So these are present in the individual. This is the most common form of diabetes mellitus, and is highly associated with the family history. So if there is a genetic history, if the parents or grandparents are suffering from diabetes mellitus, the younger generation can acquire the diabetes, type 2 diabetes. Prevalence is rapidly increasing, and it is also being found more often in younger people. Nowadays, no, the obesity is seen in younger people, they even goers and the college goers, because of the food habits, junk food eating habits. Okay, you can see more obese children, obese adults, young adults nowadays. This is the reason why they, and apart from this, they keep watching the stick on to the mobile phones and lead a sedentary life without much exercise. So if there is some exercise, the food that is being consumed can be burnt out. If that is also not there, and a person is going on consuming large amount of food, in the form of carbohydrate, definitely it is a lifestyle disorder. Diabetes mellitus type 2 is a lifestyle disorder. So these observations are being linked to obesity, that is epidemic, that is present all over the world. So obesity is a very important cause. I mean, for the increased insulin resistance, that is seen in type 2 diabetes mellitus. Here you can see the BMI. So the BMI lesser than 25% is normal. Okay, 85% of diabetes have a body mass index of over 25. So when the BMI is above 25, what will happen? This will lead to what do you call, no, overweight. This is called as overweight. When the BMI is above 30, then it is called as obesity. So this is dangerous. So BMI, you have to check the BMI, height and the weight ratio. To take the BMI and keep our weight and height and weight under control, especially the weight under control, we can minimize the type 2 diabetes mellitus. This 55% of the people are suffering from obesity, where the BMI is above 30. So, what is the treatment and prevention of type 2 diabetes? A proper diet and good exercise habits can support weight loss and effectively limit the effects of the disease. So, we should check our weight and eating habits to control the disease, because everybody can experience one or more of the diseases in later in life. So, why not you young people should have a check on the dietary habits and the food intake, and also practice a very healthy lifestyle by doing a lot of exercise and eating healthy food, including a lot of vegetables and fruits, and avoiding the junk food can help in the prevention of diabetes mellitus later in life. So management of glucose level is required, and often insulin replacement therapy is also needed. So if the diabetes mellitus is not controlled, we have to take proper medication, and insulin therapy also should be it is also essential. What is gestational diabetes? So here the you can see high levels of blood glucose in pregnant women who have never shown any signs of diabetes before the pregnancy. So this happens only during pregnancy. So this can disappear after pregnancy, or can initiate diabetes mellitus after the pregnancy also continue. The diabetes can be continued, and it can also be transmitted to the children. So the gestational diabetes, the children, the kids born out of gestational diabetes are heavyweight. So their weight is normally when a child is born 2 to 2.5 to 3 will be normal weight of the children. But the kids born to just the gestational diabetes parent, weight will be very much higher. So it is difficult to have a normal delivery. So they need to take out the baby through cesarean section. So this is very very difficult. So about 3 to 10%, it is not prevalent, it is only 3 to 10% of the females suffer from gestational diabetes. So here what happens, the hormones released during pregnancy will increase the insulin resistance, which was not seen earlier. So babies are at increased risk of complications. Either they will be heavyweight kids, and they will also experience diabetes right from the birth. So mothers are also at risk, and the child is also at risk. So it is a treatable condition by controlling diet, monitoring glucose, and giving insulin whenever necessary. So this is a healthy metabolism. So what happens? This is the pancreas. These are the islets of Langerhans, a small portion of the pancreas, magnified. Um, So here you can see the cells producing insulin. Insulin enters the blood vessel, and it will help in the transport of glucose into the cells. So this is the normal metabolism. So what happens in type 1 and type 2 diabetes mellitus? So in type 1 diabetes mellitus, you see the stomach converts food to glucose. Glucose enters the bloodstream. Pancreas produces little or no insulin. So, because insulin is not produced, the glucose is unable to enter the body effectively. So, glucose level increases in the blood because it is not transported to the cells. This is what is happening in type 1 diabetes. In type 2 diabetes, what happens? Stomach converts food into glucose, glucose enters the bloodstream, pancreas produces sufficient amount of insulin, but the cells are resistant to insulin. So because of the insulin resistance, they are not transported into the cells. So glucose are unable to enter the body effectively, and this is where the glucose level increases in type 2. Though the insulin are produced in larger amounts, you can see the level of insulin. Here very little insulin is produced, here large number of insulin is produced, but the cells are resistant to insulin. So, so you can see the glucose. So glucose in blood, excessive glucose in blood. So let us see the clinical features of diabetes mellitus. So the most common symptoms are seen both in the type 1 diabetes and type 2 diabetes, but they vary in their degree and develop more rapidly in type 1 diabetes and more typical. So that is what is seen in the type 1. So, some of the symptoms include weight loss, polyuria, polydipsia, polyphagia. Okay, that is in type 1 diabetes, polyuria. I think urea spelling is URIA, urea. That is more amount of urine is lost in the excessive excretion of urine, water in the urine. Polydipsia, thirst. Polyphagia, it is the hunger, and constipation, fatigue, cramps, blurred vision, and candidiasis. They will have candida infection. So long lasting type 1 diabetes mellitus patients may be susceptible to Microvascular complications, that is the blood vessels get affected. Macrovascular complications like the coronary heart disease and the disease that is the what do you call peripheral vascular diseases. A clot or a lump will be formed which will affect the movement of the blood, obstruction of in the blood, obstruction in the blood flow can happen. So, what are the clinical features of type 2 diabetes? Most cases are diagnosed because of the complications or incidentally. So, they are not noticed just when they check the blood glucose level incidentally, they will happen to understand that they are suffering from type 2 diabetes. So, it carries a higher risk of large vessel atherosclerosis. So, when the glucose is more abundantly seen in the blood, what will happen? It will go and get accumulated in the converted into triglycerides, and they get accumulated in the adipose tissues. And also when more and more amount of glucose are present, they will be converted into triglycerides, and they will be deposited in the blood vessel, causing atherosclerosis, fat deposition in the blood vessel. So this will lead to obstruction in the movement of the blood, flow of the blood. So this is atherosclerosis is also associated with hypertension, increased level of lipid in the blood, and obesity. Most patients with type 2 diabetes die from cardiovascular complications and end stage renal disease. So, mostly the people suffering from diabetes mellitus type 2, if it is not checked and controlled, they will experience cardiac arrest and also kidney failure. So, this is the important features of the type 2 diabetes mellitus. So what happens? Too much of glucose inhibits the reabsorption of water. But these are the complications. What happens when there is too much of glucose in the blood? It inhibits the reabsorption of water by the kidney. So usually when a excessive amount of urine is lost, so when water excretion is more during winter, during summer water excretion is very less. So during summer, because of the sweat, excessive water is lost in the environment through the skin. So we tend to lose very little water in the urine. But during winter, what happens? Because of the temperature, very less amount of water is excreted in the form of sweat. So we experience more amount of urination. Here, what happens? The kidney will lose its ability to reabsorb water because of the excessive amount of glucose present in the blood. The reabsorption of water is affected, so it will lead to excessive urination, loss of water in the urine. And because when the water is lost in the urine, the body experiences lesser volume, so it will you will experience more thirst. So we will want to drink more and more amount of water, but more we drink, the more it gets excreted. So it gets absorbed by parts of the body in which excess glucose is not tolerated. So yeah, these are the organs: eyes, kidneys, nerves, heart cannot tolerate excessive amounts of glucose, but it gets absorbed by these parts of the body, and it will damage the eyes, kidneys, nerves, and heart. So, can you guess what kind of major complications excess glucose in these organs would cause? What happens when why diabetes is bad? If left uncontrolled, diabetes can lead to heart attack, stroke. So, the risk of each is 2 to 4 times higher in people with diabetes. So, people with diabetes have a higher risk of getting heart attack and stroke. And high blood pressure, 73% of diabetes have high blood pressure. It can even result in blindness. So, this is the diabetes is the leading cause of blindness in adults 20 to 74 years of age. So this is the atherosclerosis, plaque in the artery wall, which will lead to the obstruction of the blood flow, because see, the thickening of the wall of the blood vessel is increased. So the pathway is narrowed down. So this is the retina. This is normal retina, and this is retinopathy, excessive accumulation of glucose in the eyes. And kidney failure. So diabetes can also lead to kidney failure, ketoacidosis. So when there is excessive amount of glucose, there is an excessive amount of acetyl CoA, acetoacetic acid, and the ketone bodies. So the ketone bodies increases. So this will lead to ketoacidosis, a smell in the breath, a smell in the sweat. Okay, so ketoacidosis condition. So the ketoacidosis will lead to diabetes coma because of the imbalance. So this can also affect the nervous system, gum disease, and pregnancy complications. So these are the things, how the kidney gets affected. And this is a picture showing the urine test, dip test. There are strips. So before you can The strips can be, I mean, when you dip it in urine, you can see the color change. It will indicate the concentration of glucose in the urine. So, what are the signs and symptoms? Excessive urine production, excessive loss of water in the urine, so which will result in increased thirst and fluid intake, blurred vision. So, when the concentration of glucose in the blood increases, eyes are affected. You will experience the blurred vision. See, this is the showing. This is how a street scene looks with normal vision. With the blurred vision, it will be like this. This is called as diabetic retinopathy. There will be weight loss, lethargy. Lethargy, he will not be active, and there will be a change in the metabolism. So diagnosis. So diagnosis is a very very important I mean step for confirming each and every person in a family, especially when there is a family history of diabetes. The other younger generations should always have a check of glucose level in the blood as well as the urine. So the blood glucose concentration is checked usually in the fasting condition, called as the fasting plasma glucose test, and also in the postprandial condition after intake of food, 1.5 to 2 hours after intake of food. So you can see the glucose tolerance test, oral glucose tolerance test also can be taken, where a person will be asked to consume some amount of 100 grams of glucose the glucose will be mixed in water, and it will be given to the person, and every half an hour the what is the level of glucose in the blood will be monitored, and this is shows the glucose tolerance test. So when the FPG fasting plasma is recommended because it is easier, faster, and less expensive to perform. So here you can see the normal blood glucose level in the fasting and post prandial condition. So in normal, it is 70 to, that is in fasting blood sugar level is 70 to 100 milligram per deciliter. Post meal, it is 70 to 140 milligram per deciliter is normal. Diabetes is 125 milligram per deciliter and above shows diabetes. 200 milligram per deciliter and above shows post prandial blood glucose level. So people you would have heard having 300 milligram, 400 milligram of sugar in the blood, people suffering from diabetes. So that is too dangerous. If it is not checked, it will lead to so many complications which we have discussed earlier. So pre-diabetes is a condition where you have to check. He is like a cat on the wall, like 100, and when the fasting blood glucose will be 101 to 125, and the post prandial blood glucose will be 141 to 200. So he has to be very very careful. Just like I told you, we can either jump this side or that side. So these people have to be very cautious not to in the food habits and the exercise and other things, lifestyle habits, so that he does not become a diabetic in the future. So this is all an introduction about the diabetes mellitus. In the next class, we will study about the diagnosis of the diabetes. Thank you.